Hello, everyone. Today, I have Dr. Jason Khadavi today, who is a podiatrist in Southern California. How are you doing, Dr. Khadavi?
Good, Alan. How are you? Thanks for having me.
I'm doing good. Are you ready to get started?
I am.
All right. What inspired you to get into medicine?
I always knew I wanted to go into medicine to help people. I always knew it was part of my personality to go into that manner. And so, from an early age, I knew I wanted to be a physician and be in something that could help people. So it worked out.
Yeah. Why did you specifically go in the route of podiatry?
I had a lot of foot problems as a kid. I played a lot of sports, and so I went to the podiatrist at a young age. At first, I thought I was going to go into cardiology, but then I did a rotation in it, and kind of saw what was involved, and so I saw that wasn't for me, and so then I continued to go to the podiatrist more and more, and enjoyed what they did. I enjoy sports medicine. I enjoy many of the aspects of patients coming in unfortunate problems, and then we take care of them, and they walk out in a much better state. So it was a field of medicine that I really saw myself going into and liking what I was doing, and it worked out.
Yeah. What did you like specifically about sports medicine? Did you like the fast pace? Did you like the patients that you saw?
I love sports myself, so I watch a lot of sports. So I liked seeing how I can help athletes do their craft in a better manner. So whether it was getting them into orthotics or talk to them about better shoes or their mechanics or their biomechanics, ways of getting them to do things at a higher level in a better state.
All right. Yeah. And what was your journey to becoming a podiatrist like? Tell us about that timeline.
So I did my undergrad at UCLA, so that was a 4-year program, and then once I transferred from that, I went to podiatry school, which was at what's called Samuel Merritt, up in the north, and that's just like a medical school, but it's focused on podiatry. So that was a 4-year program, and then I went to a 3-year surgical residency at St. Mary's Medical Center in San Francisco.
Yeah. And how was your training in podiatry different from like medical school or PA school or something?
So our training is more focused on foot and ankle related. So everything that we do is for foot and ankle related. We have the same intern year, the first year, which is broad spectrum. So we do all medicine, but our training, our education is really all foot and ankle related.
Are there people that like go into podiatry school and then they realize that maybe this is not for them and they transfer out? Is that something that happens?
Unfortunately, there's some people who go into podiatry school and realize that it's not what they want to do, and they will transfer to a normal medical school, or I had some classmates who became chiropractors or physical therapists or different aspects of medicine that just wasn't podiatry.
So would you say that it's kind of a little more flexible, or is that just some like misconception that I have?
No, I don't think it's more flexible than anything else. So there's people who go to med school who transfer out and go into other fields as well. So I don't think podiatry is more fluid than the other fields.
Yeah. So what was the most interesting thing that you saw in podiatry school or your residency?
So during my residency, I worked at a practice that worked with the San Francisco Giants, the baseball team. So that was, from my standpoint, again, working with the athletes, seeing what they do from their level of training, doing things that I could help them, again, play in games or do their activities at a higher level was great for me. It was a really great experience.
Yeah, that's really, really cool. Are there a lot of programs that are associated or affiliated with sports teams, like in a traditional like medical school sports medicine route?
There are, I think there's a lot of programs that work with, they might not all work with pro athletes, they work with collegiate athletes or even high school programs, but there's a lot that are tied into athletics.
Yeah. How do you still work with pro athletes or athletic teams?
I do. I've been lucky enough to have pro athletes that come through that I work with, that I see, that I've been able to work with and continue to work with.
Great. So tell us about a patient that like you'll never forget, something really bad happened to them, or you just had a great relationship with them.
Um, I had a patient who was a female patient who had just different pathologies of her feet, unfortunately. So she had many things that were going on that limited the shoes that she could wear, the activities that she could do, everything that she could do, unfortunately. It was something that was weighing on her. So, for example, she wanted to wear shoes that were nicer and she never could. She wanted to do activities that she couldn't. And so we did surgery for her to fix those problems. And I mean, she's now 2 years out of surgery, and she's been able to get into all different types of shoes that she could never wear. She's been able to run marathons and do things that she wasn't able to do before, that she was very grateful for and very thankful for. So that's the part of the practice that was really just made me feel great, to be able to help somebody who could do something that they haven't been able to do, that they could do now.
Yeah, I feel like feet are some of those body parts that you don't really know what you have until it's taken away from you.
That's exactly right. So people don't realize how important their feet are, unfortunately, until they have a problem with them. So yeah.
Yeah, in medicine, like hand call is very infamous for people doing crazy stuff with their hands. Would you say that that's similar to for feet as well?
I think it has some similarities. I think the hands, just like the feet, are as important, if not more, because you do so much with your hands. I think feet, again, just being able to ambulate and walk and do your activities are so key, that I think when you do have problems that happen in the feet and you have to take care of course, patients feel a lot better. So I think it's very similar.
Yeah. What are some of the most common procedures and pathologies that you see in your day-to-day clinic?
I do a lot of ingrown nails. Unfortunately, patients get nails that are digging into their skin and cause infections and those types of things. So I do a lot of ingrown nail procedures. I do a lot of surgery. So I do a lot of bunions and hammer toe procedures. I do a lot of sports medicine. So I do a lot of orthotics. So I make a lot of custom orthotics for patients, pro athletes, for athletes in general, gait management, training. Another common thing is plantar fasciitis. Patients come in with heel pain that we take care of. So we treat that as well.
Yeah, and how does the conversation go of if someone needs orthotics or if they don't need orthotics versus like depending on the condition of their feet?
So I think it all depends on their pathologies. It depends on their pain. It depends on where they're having their pain. A lot of it depends on their gait, how they step. I have a brand new technology, which is called Go 4D orthotics, which are 3D scans. So it takes a 3D scan of the foot. It watches the way you walk. It watches your biomechanics and makes an orthotic based on that information. So patients who come in with ambulatory issues, or they might have heel pain or whatever it might be, we can make them a custom orthotic that is really precisely made for their foot, that helps with what's going on.
Yeah, you talked about gait management. How does that? Is you retraining someone on how to walk, or they had like an injury?
So, right, patients have injuries, patients have problems that changes their gait subconsciously. Some people will walk differently, you don't even realize it. So there are things that we do to retrain yourself how to walk back to normal. You know, a lot of times it comes back to orthotics and things that we put into the shoes to really manage the way that you do your walking.
Yeah. Is there like a rehab component in what you do? Just if someone had a really bad injury to their foot and they don't necessarily need like an orthotic, but they need to relearn how to use their foot in like a natural way.
Absolutely. I mean, we work very closely with physiotherapists. So a lot of times if we do procedures or we do things that patients go through and then they need to rehab and regain their strength in those areas, we work with the physiotherapist for the patients to get their strength back and able to do those things actively.
Yeah. And let's go back to your training for a second. I know in some specialties, like being a physician assistant, for example, residency is not required. Is it required for podiatrists?
It is now. It didn't used to be. You used to be able to do, you just couldn't do surgery. So if you want to be a surgical podiatrist, it is mandatory. But I think now it's mandatory all throughout. So any podiatrist that comes out, it's mandatory to have a residency done.
Yeah. And what was your residency like?
My residency was great. I mean, our residency, we worked at a lot of county hospitals, which was great. So San Francisco General, Highland Hospital in Oakland. So I saw everything from gunshot wounds to the foot to wounds, diabetics, all different types of fractures, trauma, all different types of things.
Do you get a lot of diabetic patients in your practice who have like gout and stuff like that?
I do. So diabetes really, for the most part, affects two body parts for people. It's their feet and their eyes. So I have a lot of diabetics that come in that I treat. We do foot, checks, full foot checks, make sure things are okay. Diabetics are more prone to infections and foot infections, so we make sure that everyone's doing okay.
Did you ever have to like amputate somebody's toes because of like severe diabetic complications?
I have. Unfortunately, I've had patients who've had some vascular issues and things that we've had no choice but to do amputations, unfortunately.
Yeah, in the ER, I remember one patient would like just the toe eventually got amputated. At least from what I remember, but it was pretty nasty.
Yeah, that's not I hate to do that. That's not the fun part of what we do. Unfortunately, it's necessary, but it's not the thing that I enjoy the most.
Yeah, but you're helping them in their own way.
Long run, correct. Yes, in the long run, it's what's best for them.
Yeah. How is podiatry school and being a podiatrist with a DPM different from, let's say, an MD who specializes in foot and ankle surgery?
I think they're very similar. I think if it all depends on your training. I mean, again, so I think DPMs, Doctor of Podiatric Medicine, we're only focused on foot and ankle stuff. So all we can do is foot and ankle. Whereas MDs who focus on foot and ankle related issues, a lot of them have done fellowships. A lot of them have done further training so that they're trained in foot and ankle. They're trained in the whole body for the most part, but they focus on the foot and ankle. So I think what we do is very similar.
Yeah. Is there like a specific part of the foot where you're not allowed to go above it?
So our scope is up to the ankle. So we go up to anything related up to the ankle, we take care of.
Okay. So I heard from the grapevine that there are some podiatrists that operate on knees. Is that like common? Have you heard of that?
I have not. No, I've never heard of a podiatrist who's done anything to the knee.
All right. That's good then. I guess it's just a rumor of what I heard.
Yeah, I've never heard that.
Yeah. So talking about plantar fasciitis and foot problems, there's a trend on the internet of like the barefoot lifestyle where you have these shoes that have wide toe boxes and you wear toe spacers all the time. Is that good? Is that good for everyone? How do you feel about that?
I mean, I think it depends from patient to patient. And that's what I always tell patients. There was a time where, for example, like the Vibram 5-finger shoes were a very hot topic and patients were trying to wear them. I had some patients who were running marathons and they were running even faster. I had some patients who were coming in with stress fractures because of it. So I think it depends on your anatomy. I think it depends on what your body can and cannot tolerate. Some patients do great with the barefoot stuff, and if they're able to strengthen their feet, they can do it. Unfortunately, some patients just with their anatomy and their foot types cannot tolerate it. So they're not able to really be in that barefoot mode. And it's the more stability and support. So again, for them, it would be more of the other side where they'd be in orthotics more, or shoes, again, that give them more support would be the ideal situation.
What is something you look for when recommending either going the barefoot route or advising against it?
I think their arch height is really important. I think how the foot sits, if it sits in a collapse, what we call pronated state. I think age is important, activity level. There's many factors that come into play as far as that goes.
Are orthotics kind of like a catch-all for fixing foot problems, or are there just certain things that they're not really good for, like people are not really good for?
I will tell you, I think from my standpoint, many people can benefit from orthotics. I think a lot of times having the right stability and support in your shoes can not only help the foot, but it can help the knees, the hips, the lower back, all those types of things. Are they for everybody? No, they're not. I think there's some people who just cannot tolerate them. They do not like them. They just don't like something like that in their shoe, and they just can't tolerate it. But I mean, from my standpoint, a lot of patients do well with them because, again, it helps with alignment and really keeps them in a better position.
Yeah. And just talking about shoes in general, what is something you look for when telling a patient that they need to move away from a certain kind of shoe or move toward a different kind of shoe?
So I think patients that, again, come in with what are called pronators, so they have flat feet, so they collapse down. Shoes that have more stability and support go a much longer way. So I always tell patients they want a shoe that when they come to bend it, it doesn't bend. That's really what helps. Brands that I usually go towards are Hoka's, Brooks, Asics, New Balance. Those are usually the brands that I go towards. But again, for them, we want shoes that give them a lot more stability and support.
Are there like different sports shoes that provide that, like a basketball shoe or a tennis shoe that you would recommend to somebody who isn't necessarily an athlete?
Absolutely. I think there's different shoes for different activities and different problems. So a lot of times, again, it's patient dependent and what's going on with them, but we try to get them to the right shoe that helps them.
Yeah. Are there like any shoes that you would advise for like the general population to basically never wear?
Um, Not really. I mean, again, it depends from patient to patient. I will say a lot of the minimalist type shoes. So again, like the Nike Freeze and those types of things. Unfortunately, really, it's like you're walking barefoot, and a lot of patients just can't tolerate it. So I usually don't go towards those. I usually go more towards the more stability type shoes for patients because that's what they need.
Yeah. And just one more question about your schooling is what was the most valuable thing that you learned throughout your medical journey?
The most valuable thing I learned, I think a few things. I think patience is very important. I think being patient with people and really um, just letting them, because patients who are people who come have pain. That's really what they're dealing with. And so you really have to be compassionate, empathetic, understand that the patient who's coming has pain. So you really want to be patient and listening. I think that is really important also. A lot of times patients can tell a story as far as what's going on. And so if you really listen and you pay attention to what they're saying, it can lead you in the right direction from a treatment standpoint.
Yeah, when I was working in the ER, the doctor that I work with said that everyone's tests have um, assumed that the patient's history is exactly like the textbook and that their symptoms are like they can articulate it perfectly. And you don't really learn how to work with someone who says they have a bunch of non-specific things and can't fully articulate what's going on with them.
Sure. Yeah. I mean, it's important to really listen again to you're basically doing a little bit of detective work sometimes. So you want to ask the right question and see what the patient says. So again, you can do the right treatment for them.
Yeah, what's the most like common, I guess, um, non-specific symptom that you see? She's like, I have pain like all over my foot.
Yeah, I mean, unfortunately, some patients, for example, diabetics will get what's called peripheral neuropathy, unfortunately, where their nerves get affected. So they'll come in and just with excruciating pain of shooting, burning, tingling, and all over their feet. So those are things that we hear all the time, unfortunately.
Yeah, I mean, it's just a killer, diabetes.
Yeah, it's really hard, unfortunately. Yeah, yeah.
So, if I recall correctly, about 2 or 3 years ago, you opened your own clinic. Is that correct?
That's correct. Yeah.
So, how did you go about like differentiating yourself in the private practice podiatry space?
Um, I try to, again, really try to give the best care to patients. And I think that's really goes the longest way. So the more I can treat patients well and give them good care, I think the better they off they are. And the more that differentiates me for the most part.
Yeah. How would you say that you grew like your clinic the most? Was it because you were providing high quality care and the word of mouth just spread, or was it through some other means?
I think word of mouth is usually the best way. So if I, a lot of times if I treat somebody and I treat them well, they'll go and they'll tell their friends, and it spreads more and more. So word of mouth is usually the best way.
Yeah. And is a lot of your practice like follow-ups and people you've already seen?
I think it's 50-50. I mean, we get a lot of new patients who come in, unfortunately, with new problems. We get a lot of follow-ups, surgical patients. Yeah, so all different kinds.
Yeah. And there's this trend of less and less new like graduating doctors going into private practice. I think it's like 40% now when it was like 60% previously. How do you feel about that and why do you think that is?
I mean, it breaks my heart. Unfortunately, medicine is going through a lot of things, insurances, reimbursements, all the types of things. So it's harder to be in private practice more and more.
Would you say that it's worth it to open up your own private practice?
I think so. I mean, I think, everything has its pros and cons. So I think there are pros with going with bigger groups. For example, let's say working for a Kaiser or working for a bigger group like that. I think there are pros on going on your own and being able to practice on your own and do your own thing. So I think everything has its pros and cons.
What was the biggest difference that you experienced when going from like the hospital system of your residency to going over to your own private practice?
I think the biggest difference is just for example, like in hospitals, patients are fed to you. You know, it's a source where patients just come in and you see them. Whereas when you're on your own, you really have to do things to get patients to come in through the door. Nobody's just going to walk in because you're there for the most part. So it's about, there's many aspects from you know, advertising and again, being a good doctor, giving good care so that patients continue to come back to you.
Yeah. Would you say that podiatry is very like geared towards private practice rather than like a different specialty, like, I don't know, surgical oncology that probably is not?
No, I think you can go either way. Again, I think podiatry, there's a lot of podiatry that's done in, again, bigger Kaisers and bigger places and bigger groups. And I think there's some that are done in private practice. So I think it's kind of geared really for both.
Yeah, and I'm sure that you don't see like as much of the crazy stuff, like the trauma that you saw, like gunshot wounds, things like that.
That's right. A lot of that stuff comes through the hospital, comes through the emergency department. So I don't see a lot of that.
Is there like a part of you that wants to go back and do trauma call and things like that?
Not now, no. Trauma call is that's a tough thing to do. Again, you're getting called at all hours of the night. So I'm okay. I've done my part.
Yeah. You've done your duty. Now you're ready for your regular hours.
That's the hope. Exactly.
All right. And what are some new like exciting technologies that are coming out in podiatry? You said like the custom orthotics that recently came out.
Yeah, I mean that's been a great thing. Again, the 3D scan and using that kind of technology to be able to do orthotics has been great in comparison to the way that it was done before. It's much more precision based. A lot of new implants for surgeries, techniques, technologies, things that are allowing us to have patients on their feet a lot faster, get them back to their activities much quicker, where it would take them a lot longer before. Different treatments for different medications that are coming through that are helping patients with neuropathy and those types of things. So there's always things that are coming through the pipeline that are helping patients.
Yeah. And in my mind, podiatry is not a super like, I guess like minimally invasive kind of field because you're working with a very small like area. Is that true or is that like a misconception?
That's a misconception. I mean, there's a lot of minimally invasive surgeries that are now happening. Achilles tendon rupture repairs, bunions, all different types of fracture, open reduction, or reduction internal fixations. So there's a lot of things where it's going more towards the minimally invasive route, which is great.
Yeah. And how does that like work? Do you have just really small instruments and really small incisions and you just maneuver as much as you can?
For the most part, yeah. So you work through small holes. I mean, again, there's new techniques and new technologies that we use that make it a lot easier to do those types of things to fixate problems.
Yeah. And robotics is becoming a very hot topic. How is that being integrated into podiatry?
I don't think it's being integrated in podiatry yet. I haven't seen it, at least myself, but I'm sure with time there will be a way where hopefully we can use it for the good of the patient.
What's something that like you hope a new technology will come out to fix it, I guess, or help you with a certain procedure or problem?
You know, one thing that we deal, I don't know about technology, but one thing that we deal with a lot is toenail fungus, unfortunately. And there still isn't something that's 100% that works great for patients. So having something that would help patients for that would be wonderful.
Yeah, does not sound pleasant at all.
Yeah.
Is it like a topical thing that you give them
There's
or like
topicals, there's an oral medication, but there's still nothing that's 100%. And the oral medications come along with some side effects. And the topical medications only work a certain amount. So there's nothing that is really steadfast.
yeah, I mean, there's always those problems in very specialties. Like I guess headache is the first thing that comes to mind. It's not really anything that's pointed. It's just kind of generalized treatment for a lot of people.
That's right. Yeah.
Do you think that podiatry you can tailor your treatment for most people, or just it's like kind of the same thing for most people?
No, I think you can definitely tailor it. I think things are very different from patient to patient, and even the same pathology is different from patient to patient. How you treat them, what the best treatment is for them. There's a lot of aspects that you want to take into consideration.
Is that something that drew you toward like the sports medicine kind of podiatry route?
Absolutely. I mean, again, it's something that I enjoy helping patients. It makes me feel great when patients come in with pain and they leave without pain, or they are having problems and things now improve and they're able to do things that they weren't able to do before. So that's a really great feeling.
Yeah, and you talked about how you cardiology kind of you steered away from that. Was part of it just like the, I guess, like kind of the chronic nature of it that you have to always follow somebody's like condition versus podiatry, you can get them in and out feeling a lot better in a like one or two visits.
It was more so, for example, I had a patient who passed away on me because they had cardiac issues, and so I took that very hard. So it was something that I just didn't want. I knew that my personality, I would take it too. It would bother me too much, and it just wouldn't work out for me.
Yeah, I've talked about this in other interviews, but like the outcomes of patients is something super important that not a lot of people think about because they're like, oh, I want to do neurosurgery or I want to do open heart surgery, but they don't realize that a lot of the patients that go through that are very, very sick and they don't always make it out of the OR. So
That's correct. Absolutely. Yeah.
what kind of medical student or person is really drawn to podiatry? Maybe they're not really sure like what specialty they want to go into. How do they know that podiatry is right for them?
I think somebody who likes orthopedics, somebody who, I mean, again, podiatry has many aspects of it as far as medicine goes. It has dermatology, has orthopedics, it has, again, biomechanics. So I think it's somebody who fits into those types of realms, and again, they enjoy it, they like it, and it works out for them.
So would you say that someone who's kind of like likes to be a jack of all trades but a master of none kind of it would be drawn towards it, or because of like the specialized kind of nature with one body part that they maybe should look in a different direction?
I mean, again, I think there's many ways to do it. You could be a jack of all trades and not be specified to one thing. And I'm always of the consideration you want to be good at the things that you do. So I think that if people are looking at specific things that they want to do, right now, medicine subspecialties are a very big thing. You know, people really having a niche as far as what they do. So I think it just depends on what they look towards from a treatment standpoint that works for them.
Is podiatry like a field where people can actually specialize? They can do specialize in certain procedure, or like they do only bunions, or they only do.
Absolutely, absolutely. I mean, there are podiatrists who only do ankle fractures. There are podiatrists who only do bunions. There's podiatrists who only do certain treatments. So yeah, I think you can definitely subspecialize and do what's right for you.
Yeah. Are you personally specialized in something, or you just
I do a lot of bunions and hammer toes, and that's really one of my specialties that I do. So that's something that, I mean, I do a lot of aspects of podiatry, but from a surgical standpoint, those are the ones that I focus on the most.
What is hammer toes? I've heard about a lot about it, but I don't really know much about it.
So a hammer toe is when your toe basically contracts. So instead of it sitting in a straight position, it'll start to contract and sit in a hammered position like this. So when you wear shoes, it's painful. Every time you walk, the pressure you put, things don't feel comfortable.
Yeah. And is that normally caused by footwear or just like a genetic factor?
And both. So part of it can be genetic. Part of it can be if you're wearing shoes with tight toe boxes, things that are going to squeeze the foot a little bit more that can cause it to happen.
Yeah. Let's go to some of my last few questions of like advice you give to people. What's your advice to someone who just now wants to start their own private practice but is unsure of it?
I think if private practice is the right thing for you, I think I would go. Don't be scared. That's the biggest thing. I think, unfortunately, being scared and scared mentality is a thing that definitely pops in because you worry about if it's going to work, if it's not going to work. So I think private practice is what you want to do. I would just go straight forward with it and do it head down.
Yeah. How does somebody or what kind of personality really goes toward that, and how does someone know if they're ready, if they want to?
That is a very tough question. I think knowing you're ready is just how you feel. I think it has to be the right time. I think it has to be the right thing for you. You have to be willing to take the risk. And I think that has to fit as far as your life, your course in life goes. And I think that, again, private practice comes with its difficulties as well. A lot of things that we do, unfortunately, are customer service based. So you have to have that kind of personality where you want to be able to really give that extra care for patients, make sure they are happy with their treatments, go through the ups and downs that come along with it.
Yeah. And what's your advice to the aspiring podiatrist right now?
I would say it's a great field. I love podiatry. I think it's a great field as far as medicine goes. I think it can definitely, you're helping patients, you're helping people, and I love it.
If something happened and you had to redo, you were put back in your undergrad self, would you go through your podiatry training again? And if so, what would you change about it, if anything?
I would. I think I'd go through the same training. I think I'd go through the same experiences. What would I change about it? I'm not really sure what I would change about it. I thought I really enjoyed my training, and I enjoyed everything that I've gone through.
Yeah. So no regrets, basically.
Not really. No, I'm very happy with where I am, thankfully. So I'm happy to be where I am and what I do.
All right. Thank you so much for the interview. I really enjoyed myself. You have a good time?
All right, I did. It was great. Yeah, thanks for having me.
All right.
I helped and answered everything.
Yeah, thank you so much. Hopefully I'll see you around.
Sounds good. I'll talk to you soon.
Yeah, thank you. Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.